Hi, I'm Dr. J.R. Barone, and I am here with Louise Fisher, who's a longtime practice member of Barone Spinal Care and Performance. She's been under Upper Cervical Care here in our office for quite some time. She started back in 2005. It is now the 11th of March, 2011. So, Louise, share a little bit with what brought you in originally, and what your first experience was like in the adjustment, and then we'll talk about some of the improvements you noticed.
Okay. Well, when I started coming to Barone's, I wore magnets to kill the pain. I wore a little one on the back of my neck, a little one on the back of my shoulder, a little one inside my knee, and I wore two big ones on my back and one big one on my right leg in the back, and that helped kill the pain. And I started coming to Barone's. It was really fantastic because now I am without any pain at all, and it's really wonderful to be 80 years old and not be in pain.
And share a little bit about what that first adjustment was like for you. Were you scared when you came in to get your first adjustment?
I really didn't think they could do anything for me. I honestly didn't, but boy, they certainly have.
Yeah. Okay.
I'm really appreciative of Barone's.
And now you made a comment a little earlier that I thought was really neat, and you had mentioned that that you felt I said, how long has it been since you felt this way? And you said initially 30, and then you said 40, somewhere in that range. But she's 80 years old, and she said,
I feel better than I did when I was 40.
40 years old. Think about that, okay? So 80 years old, for those of you out there that are in your 80s, in your 90s, in your 70s, and you think that my aches and my pains are because of my old age, this is a prime example of how that just isn't true in most cases. And she could have easily given up and said that my aches and my pains are because of my age, but she didn't. She gave this a try. She got the upper cervical adjustment. Now when she came in, Louise, originally when you came in, your left leg was an inch shorter than your right, your left leg was an inch shorter than your right leg. Your posture was off. In your x-rays, we found 3/4 of a degree of a misalignment. Now to put that into perspective, that is the thickness of a fingernail, 10/1000ths of an inch, which is the thickness of a matchbook cover, 10/1000ths of an inch. All right, we found that on x-ray. We gave her a very gentle adjustment that she couldn't feel. She's 80 years old, and she hasn't felt like this until since she was before 40 years old. So, that's really, really exciting. Now, there's a lot of people out there. Now, Louise also happens to be one of our top referring patients. She sends people here all the time. We've got her daughter sitting up here on the table next to us. We've got another one of her daughters here. She sends friends and family here. What is it that gives you that passion and that excitement to tell so many people about our services, and that drives you to want to help these people the way you do?
Well, you just can't imagine how I hurt, and now I don't hurt at all. So I'm definitely going to refer people because I no longer hurt. It's wonderful.
Yeah.
Fantastic.
How was that interfering with your day-to-day life? You said you can't imagine how bad I hurt. Try to help us understand what that was like for you. Obviously, it was very significant for you, the changes, but help us understand what that actually felt like.
Well, I'm a person that you have to go on, so I just got up and went on. I mean, you can't just sit around and gripe and complain, or I can't anyway, and I just try to go ahead and live my life like I should.
So you kind of grit your teeth and work through it, but what was really going on under that? You had the face on, and no one could tell what was really going on with you because you were driving hard, but what did your body feel like during that time?
Well, if I didn't have the magnets on, in fact, one time I was going down to my daughter's, Kathy's, to Texas, and I went into the restroom, and the magnet that I had on the back of my leg, I left it in the restroom, and I thought, oh well, I'm going to be back before long. I'll be okay. I can get another one. But when I got home and got it ordered, it took me almost 6 months for my leg to, not hurt when I had the magnet on. You just can't imagine the pain that you can have when you're out of alignment.
Mm-hmm. And now she, the magnets aren't necessary. Her nervous system's functioning properly. By the way, her 1-inch short leg came down to even. Her legs evened out in the first adjustment. They were an inch off. They came even, and as long as you're in alignment, your legs are even, your hips are level, your posture's right, and you're feeling better than you have in 40 years. So, any last words you want to say to these anyone that might be watching this right now?
If you really want to get an adjustment or find out if you need an adjustment, I suggest that you go to Barone's. Yes, you do need x-rays and you will have to pay for them, but I can tell you it's worth the money you're spending.
Okay, yeah. All right. So, Louise, thank you so much for, sharing your story.
You're welcome.
And I'll give you a hug too once we stand up. And thank you so much for sharing your story. And there's so many people out there right now I know that are going to be watching this video and are going to get help as a result of you. And there's so many people that already have had help, and we're excited to continue to help you as well. So that concludes this session.
Well, I do want to mention that I did go for 11 months without an adjustment, so I think that's pretty good.
She held her adjustment almost a year, 11 months, and yeah, that's very unusual. In most chiropractic offices, every time you go, you get an adjustment. She held her adjustment, and remember, it's not the adjustment that heals the body, it's holding the adjustment that allows the body to heal. It's very, very different. And so, yep, that's key. Okay, over and out.